Good day, my dear students. The class for this session is short, at the same time, a little difficult for the students to explain. It is a foreign body granuloma. What is a granuloma? A granuloma is nothing but a localized aggregation of macrophages. And macrophages are nothing but the counterparts of histiocytes, the counterparts of monocytes in the blood. They are aggressive in phagocytosis, but sometimes they get changed into epithelium-like cells, which are epithelioid cells. So you have got an epithelioid granuloma and a foreign body granuloma. Epithelioid granuloma with necrosis you shall see in tuberculosis. And a foreign body granuloma is this slide. Let us see what we have to identify. I am not what happened to me. I am what I choose to become. And definitely, my dear students, you will become what you shall choose to be. This is a wonderful black and white photograph. What are we seeing? I would like you people to kindly concentrate on the picture and see how many components you can identify by yourself. First, there is a circumscribed lesion. For us pathologists, it is very easy because our eyes are tuned to it. But for you students, it is a little difficult, but still use your imagination. I am finding a localized aggregation of cells. There are many pale large cells. Look at this one. This is a pale large cell, another cell, etc. This is again a pale large cell. The dark one is the nucleus and the pale one is the cytoplasm. So these are the macrophages or the histiocytes. They may fuse together to form multiple nucleated giant cell or a multinucleated giant cell. In the background, I am able to see loose connective tissue. You can imagine a network behind. This is what is supporting the tissue. So there is a loose connective tissue. Also, there are many dark blue dots scattered throughout, which are nothing but lymphocytes. Look at this picture over here. So there is a giant cell, multiple nuclei are there, and there is some whitish or refractile material within, which I would like to call a foreign body. If this is not convincing enough, let us have a look at this one. The blue line, within which I am finding an amorphous material with some kind of striations. It is probably a suture material or some other foreign body that has been left behind in the tissue. So what do the macrophages do? They accumulate around it or gather around it to form a granuloma. They may fuse to form multinucleated foreign body type of giant cells. This picture will be little more clear to you people. I am finding a large irregular amoeba-like cell and there are multiple dark nuclei within. So this is a multinucleated foreign body type of giant cell. In this one, I cannot count the number of nuclei, so many. Sometimes it can be even up to 100. That is what Robin says. But 20 to 50 is a reasonable number. And scattered throughout the slide, I am able to see multiple small blue dots, which are nothing but the lymphocytes. Look at this one. These are all the lymphocytes. These can be, there is a nucleus eccentric and this can be a plasma cell. A plasma cell is probable, and this is a large giant cell that I am seeing. There is an aggregation. Some of the cells are all pale. They are all probably the macrophages over here. So foreign body type of giant cells, macrophages, lymphocytes, I can make out easily. This is a wonderful schematic picture that has been structured by an engineer and not a medical professional. In this one, there is a biomaterial which is not getting digested. Let us not go into the nature of these materials. Around this one, I am finding there is an accumulation of these giant cells, multiple nuclei, large cells, the macrophages. They have got a slightly kidney-shaped nucleus. Then there are the lymphocytes. Always a granuloma means it has to be limited to one area. Therefore, what does the body do? It creates a network which is spun around the lesion, and this is fibrosis. And this is caused by elongated cells called fibroblasts. So you will be able to remember all these things. And what are the foreign bodies we will have to think about? It can be talc material that can be left behind after surgery. Suture material, again, left behind after surgery or incomplete removal of the suture. There can be degenerated cells from any of the tissue. Once it is dead, it is a foreign body to the other cells. Cholesterol crystals, which we shall be seeing. And all these components are labeled here. I would like you people to kindly make a note of them. Cholesterol crystals are rhomboid or somewhat elongated cells which are pale. You find that it is colorless, needle-shaped structures, and this is actually a giant cell. Multiple nuclei are there. It has engulfed this cholesterol crystals. This is also another giant cell that has engulfed the cholesterol crystal. And this is the stroma which has got lymphocytes within it. This is another one. Look at this phagocyte or the giant cell that is encircling it, trying to engulf the entire material, which might be a suture material. This is reflected in this picture also. So it has been engulfed. This is called a phagosome. Then the lysosomal enzymes come, they digest it. And multiple nuclei, foreign body type of giants. Two giant cells we shall remember for the time being. One is a Langhans type of giant cell. The nuclei are distributed in a necklace-like pattern, whereas in this, there is a central aggregate of them. This is called a foreign body type of giant cell. This is a Langhans giant cell. This can be seen in tuberculosis. This can be seen in any foreign body granuloma. Gracias. Courtesy, Alami.